Hello, everyone. I am Elizabeth Igaga. I am an anesthesiologist and lecturer at Makerere University in Kampala, Uganda. And today I'll be talking about protecting the anesthetist. From the WFSA Workforce Survey, we know that we have less than 5 physician anesthesia providers in the lower middle income countries. The Lancet Commission recommends about 20 surgical anesthesia and obstetric physician providers per 100,000 population. In my country, Uganda, we have about 0.18 physician anesthesia providers per 100,000. And even when you add non-physician providers to this number, the number is still a far cry from the Lancet Commission's recommendation. Anesthesiologists in my country, as is in other places, also double as ICU physicians. So we don't really know how big the problem is, but this is just an attempt for us to quantify. The past 1.5 years came with even bigger problems for us with our already meager human resource. The patients we received in the wake of this pandemic were critically ill, and therefore there was an increased demand on the skill set that we have. In addition, we had to work long hours in poorly resourced settings in terms of infrastructure and with limited availability of PPE. The most devastation, however, came from the uncertainty that was associated with being on the front line. We asked ourselves questions like, what happens if I fall sick? What happens to my family? How are my bills going to be paid? But the pain of losing close friends, relatives, and colleagues was unbearable. So we started asking ourselves a few questions and what we could do to help each other. We've been advocating for shorter shifts just to ensure that people have time to rest in between the shifts that they have to do. But we're also trying to ensure that the anesthetist does not work alone. The Association of Anesthesiologists of Uganda and its partners have set up a call center to support anesthesia providers wherever they are, especially in the rural areas. If we cannot be there physically, we shall be there virtually. We're also advocating for incentives, not only financial incentives, but other incentives that help the anesthetists and the other health workers feel like what they are doing makes a difference. The work we do needs to feel rewarding. A recent study done on important job attributes for the physician anesthesia provider in the rural areas revealed that most physician anesthesia providers would be comfortable with the presence of a colleague and quality infrastructure in the areas that they work. And this came a lot more than people having better salaries or housing where they worked in the regional referral hospitals. We're advocating for hot debriefs. And what this means is when an incident occurs, it is talked about and analyzed at the earliest possible time and not kept and shelved and dealt with as a cold case. This helps us plan better. It helps us learn from the situation and also relieves the mental stress of thinking about what you could have done better or what you could have done differently over and over again until such a time when the issue is solved or talked about. We're advocating for resourcing work environments better. The pandemic opened up a gap and just showed us how we hadn't, as a country, invested in infrastructure for the healthcare system. The AAU, which is the Association of Anesthesiologists of Uganda and its partners, have done a bit of work in operationalizing ICUs at the regional referral hospitals. This is ongoing work, and we think that it's going to make a very big difference. We are continuing to advocate for opportunities for training for both the qualified anesthesiologists and the doctors who would like to become anesthesiologists. So the AAU and the Ministry of Health in Uganda are working together to provide scholarship for the students who would like to come back to school as anesthesia residents. The WFSA has been gracious enough to offer quite a number of anesthesiologists from Uganda fellowships to go and improve themselves and come back later and pass that knowledge on to the people who they find when they get back to their stations. I'm proud to say that the WCA and the WFSA have sponsored quite a number of anesthesiologists in Uganda to attend this Congress, and I am one of the WCA scholars that has also sponsored people for the previous World Congress of Anesthesiologists. And this has helped us learn, network, meet people, and be able to compare notes and see how to do things better when we get home. We are putting guidelines and protocols in place just to aid in decision making, so that that's not a burden that has to lie on only one person. If protocols are in place, they make work easier. Every anesthesia provider needs to belong to a community, either a professional community, a social community, and any other community where they can exchange ideas, vent, be supported, and be encouraged. At the end of the day, I will still pose the question, how do we protect the anesthetist? Thank you very much.